Hello, my name is Kathy, and today I'll be discussing how to use homeopathic remedies on ailments, continuing with childbirth and postnatal problems, P4. But before I do this, I wanted to let you know that because I have a great many videos now on many different topics, that I've decided to make several different video playlists so that it's easy to find the videos of greatest interest. So please check out my playlist page. Please refer to my How to Use Homeopathic Remedies video before using the material in this video. I'll be discussing how to use homeopathic remedies on specific ailments, but I've broken these ailments into categories for easier reference. I'll begin with ailments of the mind and emotions, then I'll move on to ailments of the brain and nervous system. Then I'll address issues with the skin, nails, hair, eyes, ears, nose, teeth, gums, lungs, respiration, heart, blood, circulation, muscles, bones, joints, esophagus, stomach, duodenum, small and large intestine, liver, gallbladder, and pancreas, kidney, bladder, then ailments specific to women and specific to men, then issues of the hormones and metabolism, then homeopathic remedies for infections, infestations in the immune system, then issues surrounding fertility, pregnancy, childbirth, postnatal problems, homeopathic remedies for infants, ailments and diseases in childhood, and special issues of adolescence, and finally, special issues of the elderly. Constitutional treatment involves treating the totality of the individual person. Everyone is a unique individual with a unique physiology that responds to substances differently. In homeopathy, it's recognized that people will react strongly to certain remedies, and as a result of this, they can be loosely placed into different categories called constitutional types. Homeopaths talk of, for example, phosphoric types. These are people who react strongly to phosphorus, or arsenicum album types, those who react strongly to arsenicum album. The belief is that people of one type share similarities in terms of body shape, character, and personality, and the sorts of diseases from which they suffer. As an example, Natrum Mur people tend to be pear-shaped, have a dark complexion, be fastidious and rigid in personality, and keep themselves to themselves. They also crave salt and suffer from constipation. As another example, Lycopodium types tend to be tall, ganglion of a stooped appearance, with an anxious expression and a craving for sweets and a propensity to produce intestinal gas. Now, of course, constitutional types have their limitations. In reality, each person is an individual, and so there are as many constitutional types as there are human beings. An account must be taken of the sum total of the person's inherent predispositions, past illnesses, diet, general reactions to the environment, intellectual and emotional features, and general attitude towards life. This is what is meant by constitutional treatment. I will be making detailed videos of the various constitutional types after I've completed the use of homeopathic remedies on ailments. The ideas, procedures, and suggestions in this video and all my homeopathic videos are not intended as a substitute for the medical advice of a trained health professional. Consult your physician before adopting the suggestions in this video. If you're pregnant, do not attempt these techniques without the approval of your physician. So, let us continue with learning how homeopathic treatments can help with childbirth and postnatal problems, P4. If complications are expected, it is best to have the baby in the hospital. But if this is not the case, a more natural birth method is preferred. If you have strong views on specific procedures or specific drugs, speak to your doctor about this at some point during the prenatal period. This is also the time to ask if there would be any objection to your using homeopathic remedies, as they will not interfere with any drugs that you may be given. First stage of labor. In the last week or so of pregnancy, the baby's head slides down into the pelvis, and this will in turn relieve the pressure on the diaphragm and stomach. But it will then increase the pressure on the bladder and rectum, and the whole vulval area becomes moister. Most expectant mothers will probably have felt twinges of pain in the last few weeks of pregnancy, but as labor approaches, these will become more insistent, more frequent, and more regular. The expectant mother may also feel trembly and chilly. Now is the time to telephone your doctor or the hospital. A sure sign that labor has started is a show. which is a discharge of blood and fluid as the protective plug of tissue in the cervix is shed. At the same time, or shortly after, the membranes around the baby may rupture, resulting in a trickle or sudden flood of fluid called the waters. As labor proceeds, the expectant mother's pulse will become harder and faster, and her mouth may feel dry. Restlessness, nausea, and sometimes vomiting are also quite common features of this first stage of labor, especially at the transition, where things may come to a halt before the second stage of labor begins. During this first stage of labor, the cervix or neck of the uterus opens and is pulled upward so that the uterus, cervix, and vagina form a single tube or birth canal. Once in the hospital or when the midwife arrives, the expectant mother will be given a vaginal examination to assess how close she is to giving birth, and possibly an enema given to empty her bowels. The old-fashioned habit of shaving the pubic hair is not necessary to prevent infections. The first stage of labor usually lasts about 12 hours in a first pregnancy and 6 hours in a second, but there are no hard fast rules. Sometimes the first stage takes up to 24 hours or even longer. Sometimes this first stage of labor only lasts for a few minutes. Second stage of labor. The second stage of labor usually lasts an hour or so in first pregnancies, and about half an hour the second or third time around. The contractions become stronger, and the expectant mother feels the urge to push. It is time now for the expectant mother to push with the contractions and rest between them. It is common for the expectant mother to feel like her bowels are going to open. This is because the baby's head is pushing against her rectum. It is important for her to not let this stop her from pushing. As the head comes down, the birth canal is ready to escape from the pelvis. The expectant mother needs to go into panting respiration. The midwife, doctor, or other helper will control the head so that it slips through the vagina without stretching it too much or causing splitting. If there is a fear that the vagina will be badly torn, she may need an episiotomy, which is an incision in the skin of the vagina under local anesthetic. However, with good control and gentle massage of the vaginal skin, an episiotomy is often not necessary, though in some cases it is to the advantage of mother and baby. This is something you should discuss with the midwife or doctor beforehand. Once the head emerges, the shoulders and body soon follow. The baby can then be delivered onto the new mother's abdomen. Breathing is started by clearing the baby's airways of mucus and tipping its head down. The cord need not be clamped and cut until it has stopped pulsating, unless it is around the baby's neck. Third stage of labor. This takes place 30 minutes or so and is marked by an increase in bleeding. As the placenta or afterbirth is delivered, the midwife or doctor usually pulls gently on the cord while pushing gently on the womb. The new mother may be given an injection of pyosin, which is derived from the same source as the homeopathic remedy Sakali. To make the womb contract and prevent excessive bleeding, this is a good time for the new mother to bond with the baby, have a quiet cuddle, and offer the breast. Baby check. Immediately after birth, the midwife or doctor will check to see that the baby is all right, although a more thorough check will be done later. The baby's facial features will be checked for Down syndrome, genitals inspected for doubtful sex, and fingers and toes counted, and the back will be checked for signs of spina bifida, which is indicated by hairy patches or missing skin at the base of the spine, and the navel for signs of diaphragmatic hernia. The anus will be examined to make sure it is open. A finger will be put in the baby's mouth to check for cleft palate, and the hips and feet will be checked for congenital dislocation or club foot. Once after birth, once the baby has been settled, the new mother will be washed or asked to take a shower, bathing her vaginal area with arnica solution, 10 drops of mother tincture to a half a pint of warm water. Will take away some of the soreness and promote healing. After that, the new mother should be allowed to sleep, or at least be very quiet and tranquil. At this time, well-meaning visitors and telephone calls can be very exhausting. The new mother will probably not feel very hungry for a day or two. Thin vegetable soup is good on the first day, with salads and fruit on the second, and a return to normal diet on the third day. Tea, coffee, chamomile tea, and wine are best avoided. The most important nutrients in the weeks after birth are iron to make up for lost blood, and protein to aid healing, and calcium if the new mother is breastfeeding. A mixture of blood, fluid, and mucus are discharged from the womb in the days immediately following delivery. After pains are common at this time and tend to be worse if labor has been relatively easy. It is quite normal for the new mother to feel very weary and stiff. Some women also find themselves perspiring a lot. Within 12 to 15 days, the womb returns to its normal size. After an episiotomy or a tear, the vulva and vagina will take several weeks to heal. Periods usually restart 6 to 8 weeks after delivery, but may not reappear for several months if the new mother is breastfeeding. Postnatal depression. Many women feel down after giving birth, and for many reasons, hormonal changes, tiredness, possibly due to a drop in blood sugar levels, previous episodes of postnatal depression, strains within the marriage or relationship, anxiety about coping with a new baby, financial problems, the sudden realization that life has changed for good. In a few women, such feelings, initially a natural response to a new situation, last for much longer than a few weeks and has seriously undermined their ability to cope. Symptoms include tiredness, an increase or decrease in appetite, feeling that one is a failure, feeling very aggressive towards the baby when he or she cries, and guilty afterwards, withdrawing from family, friends, and all forms of social contact, and feeling that everything is unreal. A few women completely lose touch with reality, in which case their behavior can be said to be psychotic rather than depressive. If this happens, see a doctor within 2 hours and give aconite 30C every half hour until help arrives. Otherwise, select a remedy from the list that follows. If there is no improvement within a week or so, seek constitutional treatment or see your doctor. Specific remedies to be taken 4 times daily for up to 3 days. Not interested in anything, sex least of all, feeling tired, irritable, and chilly, constipated, yellow-brown discoloration across bridge of nose, morale very good during pregnancy but very low afterwards. Use Sepia 30C. Talking excitedly and incoherently, face red and flushed, eyes staring. Use Belladonna 30C. Persistent obscene thoughts, unusual talkativeness and suspicion, inappropriate laughter, breaking off encounters abruptly and running away. Use Hyoscyamus 30C. Depression brought on by grief. Use Ignatia 30C. Feeling very weepy, not at all thirsty, and worse for heat. Use Pulsatilla 30C. Woman withdrawn, irritable, full of guilt and resentment, refuses to be consoled or comforted, says she just wants to be left alone. Use Natrum Mur 30C. SelfHelp. Mild postnatal depression can be helped by getting more sleep and by getting out of the house, away from the baby. It is important to not bottle up your feelings. Talk things over with a confidant. Take extra zinc. That might also help. I have a great many videos now on many different topics, so I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Well, that's it for now. To stay up to date with my latest videos, make sure to subscribe to this free YouTube channel by clicking the red subscribe button right below this video. Take care.